All right, everyone, this is Claire at StudentRDH. So we are January 3rd. So Happy New Year to everybody who is here on this webinar. I'm very impressed that you are here in January to understand more how you can pass the board examination. So thank you everybody for being here. We have a few minutes until we actually start the webinar. So we're gonna wait for our students to come in. So we have a chat function, guys. Do you know where the chat function is? If so, can you please put on the chat whether you can hear me or not, whether you can see me or not. And then we're gonna use the chat to communicate throughout the entire webinar, because that's where I'm gonna ask you questions, that's where we're gonna get some answers, and you can ask anything you want as well. If you have a question in the middle of me speaking, just put it on the chat. I'll look at it and I'll try to find the right time to answer that question. Thank you everybody for being here. So we have Kim, we have my computer, who I don't know who that is. We have Carrie, Rebecca, Krista, BM123, we have Tiana, Rita. I think I recognize some of you from the emails that we've been exchanging. So thank you everybody for being here today. One more thing before we start is that, do you see a mute button? Most of you are already muted already, so we can have a clearer sound when we are going through our webinar. But in case you are not muted, please find this little mute function if you can, okay? So I'm gonna let you do that. Okay, so before we start, I just want to know where everybody is from. Can you please tell me which school you are going to and which province you are? Right now, I am in Toronto, Ontario. I don't know if anybody is from the Toronto area, but please put on the chat where you are from. I'm just curious, and that can help me understanding how I can tailor also our webinar today. Okay, so we have Nazila, CADH. All right, perfect. And we have Carrie, who's from Toronto, but who is at Thunder Bay F Confederation. Awesome. No, I mean, it is quite, I think it's about 4 hours away, something like that, right? Great, thanks for sharing. We have Rebecca, who is for Georgian. Kim, who is also in Georgian. Okay, great. We have BM123, who's also from Georgian. Tiana, who went to Georgian, and we have Krista from Vancouver College. Perfect. So I also used to live in Vancouver. I hopped around a lot in my life, including the US as well. And I go back and forth to the US and Canada right now because I do work a lot with American schools as well. And I am a speaker in many of the dental conferences as well. And I also teach faculty members how to prepare our students better, not just for the board examination, but also in the classroom. Great, so thank you everybody for being here. We have a lot of students from Ontario because it's just a large province, right? I am curious here, did anybody get StudentRDH yet, or are you maybe not sure, or you won't get it? That is okay, you can tell me. Just be honest with me, just because I want to know how I can tailor this webinar for you, okay? If you tell me no, I won't be offended. It is completely your choice. I'm not here to sell you anything. I'm just trying to help everybody pass the examination. All right, so it seems like most of you have StudentRDH already. Great, thank you very much for the trust. I hope you can share those with you know, the good word with your friends and being able to help others pass the board examination. So I'm gonna jump in right now in our presentation. So again, my name is Claire. I'm the founder of StudentRDH. We communicate a lot via email, and I see some of you already did with me. Thank you for being here today. So I'm gonna share my presentation. We're gonna jump right into this because I don't want to delay anything. We have quite a few things to go through, and I want you to just feel energized. I want you to feel informed so you'll be able to prepare for the board examinations better. Okay, so let me continue over here with sharing my screen. Now you'll have to tell me whether you see it or not via the chat, guys. Can you see it? Can you see the chat? Oh, no, sorry, my presentation. Okay, perfect. It seems like it is working. So I'm going to start it right now. Great. All right, so we are back here, and this is going to be everything you have to know about the NDHCE. Every year, I look at the new guidelines. I see if there's anything that has changed. I'm trying to understand if there's something I need to share with you. And we have over 1,000 success stories at StudentRDH in Canada only. We have about 15,000 in the United States, just because it's a bigger country. Over 1,000 success story in Canada. So let's start with, the packages we have. Some of you already have it. At the end, I have a promotion code for those who don't have it yet, but don't worry, those who already have it, actually, the code won't be as great as what you already have probably. So don't worry too much. So I'm gonna start my story with Sarah. And Sarah was an awesome student. The problem though, she failed twice her boards. Isn't that scary? Isn't that discouraging? She was a student athlete. She was wonderful. She was bubbly. She had a great presence. Her clinical presence was awesome as well. However, she failed twice, and that happened before her wedding. She had her wedding. She frantically messaged me saying, I need some help here. And we did help her pass the board examination. And that was quite a challenge because we didn't have a lot of time before her wedding. She was very stressed. Long story short, you probably can understand that she did pass her board examination. And I just wanted to share this success story just because it's motivational, not because it's not just about StudentRDH. It's about who is taking the boards. That is you, and that takes equal amount of effort. We can try to provide you as much as we can, but you have to put some effort, and I'm here to help you through that process as well. So today, the reason we talk about the NDHCE, because I want you to understand the format. I want you to understand everything you have to know about that. That's kind of like the opponent. Like, let's say, we had our Toronto Raptors win last year. Was probably one of the best moment of some people's life, especially here in Ontario. But if you think about it, they went one game at a time. They scored one ball at a time, one score at a time. So it's a lot of work, right? It's not like all of a sudden you become the champion. There's a lot of work involved. But every time they had to find who the opponent is, because every opponent has a different style. So they have to adjust to that. So here, our opponent in this case, is the NDHCE, or if you want to call it NDHCB, which is the board. And the board is, has its own style. So we need to understand that as closely as possible so we can target, we can strategize the best we can. Does that make any sense? All right, so if you have questions, again, you can put it on the chat right now. Great. Now let's talk about, first of all, time. Do you know how much time the NDHCE give you for the board examinations? You can put it on the chat if you want. Do you know how much time you have? 1, 2, 3, 4, 5, 6, 7 hours? So here, yes, thanks for being here and answering those. So we have a lot of you saying 4 hours, right? How many number of questions do you have on the board examinations? 200, okay, yeah, the answers are coming in, great. And then how many sections do you have? Do you know how many sections there are in the board examinations? 2, 4, okay, we have a mix. All right, so here we have, oh, totally, sorry, probably misaligned my PowerPoint, but there are 200 questions, there are 2 sections, and you have 4 hours in total. Let's memorize that today. Most of you got it right already. Now, what you need to understand is how the exam is divided. It's not, so maybe some of you who said 4 components, maybe you were talking about the competencies. What they actually did is that they gathered all the questions together, or they made rubrics. They say, okay, we're gonna have some critical question, some less critical question, and then we group them into 1A, 1B, 2A, 2B. Now, those are very, very, very confusing, right? I mean, I don't know if anybody really understands the concept of all of those, but basically it's just a way for them to organize it. But let's think about what that means for us, okay? So let's think about that. So this is 100 questions, a break, and 100 questions, that's what you're gonna have. And this is just a kind of a screenshot or recording of StudentRDH. So you will have here a timer at the top, and you will be able to go through your answers. And this is literally me just doing it for you so you can see. And this really simulates the board examination. So it's gonna be in this format, okay? That sounds simple, right? We all know how to use a computer now. And then there's also a flag function. Okay, you in StudentRDH is in red. In your board examination, it could be a little different. However, know that there is some sort of flag function. And then you'll be able to submit your examination after 100 questions. You'll take a break. When you take a break, everybody will go out and come back at the same time, and then you'll have another 100 questions. Now, let's continue what it really means for us when they talk about all the different things that they put into this NDHCE. So a lot of it is obviously everything we had to study in dental hygiene school. There's nothing really new over here. But let's look at the breakdown. So they say, okay, 6 to 14% is about responsibility, accountability, professional relationship, health and safety. Well, if you look at the majority of it will be assessment and diagnosis. So looking at the radiograph, being able to understand what kind of periodontal condition the patient has, that's assessment and diagnosis. It's implementing, saying, what do we want to do after that? What instruments are we going to pick up? What intervals do we want the patient back? So far, do you follow me? I know it is very complicated to understand every type of information they're giving us. But again, I'm going to give you, what it actually means for us. So now you have all this information, there's category, 1A, 1B, and all of that. And you have all those 8 categories as well. Well, this is actually the breakdown of each category, okay? If you see under responsibility and accountability over here, what they actually mean is like, can you apply ethical principles? So maybe you'll have a question that is related to, well, there's a conflict between you and the dentist or between you and the patient, maybe. Okay, or scope of practice. Are you practicing within the scope? Is this in your scope or not? Maybe they can ask you questions about, let's say, 1.08, incorporate new evidence. They can ask you some questions about research, right? So I looked at it, and those are literally screenshots of the NDHCE blueprint, okay? From here, if you keep scrolling the blueprint, you'll get to those sections, and they tell you more in detail what that means. What does responsibility, accountability means? If you see client and professional relationships, what that actually means, that means demonstrate sensitivity to client diversity, okay? For example, the patient is blind. Did we accommodate for that? Or communicate, collaborate with communities. That's a little bit more in the community oral health, but that also professional relationship. What about health and safety? Are you applying infection control properly? So anyhow, there's a whole list. And instead of you reading through that whole list and still being very just confused about what am I supposed to do, this is what I did. I basically summarized on the right hand the keywords that I found through the left side component. So for example, from here, I understood that you need to study ethics and jurisprudence, including health records. Research, yes, you have to know about the research methodologies and be able to read research. You need to understand the entire dental hygiene process of care, which includes patient management and prevention. You have to understand infection control. So do you follow me so far? You can put a yes or a no. I know this part is not like super exciting, but I think it's a necessary process for us to really understand what the NDHCE is about. Thank you very much, everybody, Alexis, Nazila, Rebecca, for participating. Now, I did the same thing for the next component, which they call it the foundational knowledge. Meaning you have to know knowledge on pharmacology. Do you see on the left side knowledge on periodontology? I mean, that really doesn't give you much clue, right? It basically means you need to know everything you studied in dental hygiene school, every single chapter, every single textbook, right? All right, let's continue on the assessment and diagnosis. You need to know, let's say, vital sign. Periodontium, you have to be able to assess using radiograph, soft tissues. For example, you do a head and neck palpation so you understand if there's some potential lesions or not. So those are assessment and diagnosis. And on the right side, again, I did summarize using the keywords that I found over here. I understood we need radiology, we need to collaborate with dental specialties. Sorry for the typo. We need to understand research, we need to understand diagnosis, physiology, anatomy, and all of that. One more over here. So now they talk about planning. Well, what are we gonna do? We're gonna just be able to collaborate with the patient so that they can plan, we can plan as well, and that includes medical emergencies. So implementation, what does that mean? Are we gonna give them some drugs? Are we gonna give them some tooth whitening? You know, what are the procedures? And the evaluation means when we have a patient that we treated, how are we going to evaluate? That could be probing, that could be understanding if there is bleeding, things like that. So anyhow, again, I just summarize it on the right side, okay? So that's intervention, home care, intervals, radiograph, instrumentation, diversity, and all that. Now, again, after you get all this, you're like, now what? What am I supposed to do? Right? Even when I read this, I'm thinking, now what? So that's how StudentRDH came about, because when I actually was taking my board examinations, and that was about probably 6 years ago, you know, I had a long career of working in nonprofits before I started dental hygiene. I was an educator at the Children's Museum. I did education before I even started dental hygiene. And anyhow, even when I read this, I'm like, now what? Now I teach faculty members, I teach students this. This is what I just basically summarize it to. So they are about 17 chapters that you actually really have to know. So that's how StudentRDH was made. Okay, so for example, you'll have periodontology, head and neck anatomy, medical conditions, community oral health or pathology, ethics and jurisprudence, and all of that. Because I found this to be a lot too complicated. Now, this is what I want you to do though. I want you to just study like this with like the smaller chapters that we created for you that have key points, bullet points, and some images and everything you have to know. But at the end, you know what I want you to do? I want you to go back here, and which is the NDHCE blueprint. You can Google it. You can also find it at StudentRDH. We have the link for you. Is you can start checking things off. Let's say you study with StudentRDH or whatever else. Again, I'm not here to sell you anything. If you are studying with something else and you studied ethics, well, then you look at this list and you say, okay, now I know how to apply ethical principles, and you go through some scenarios in your head. You brainstorm yourself and you say, okay, I know this, you check it off. And then what about number 1.3, work within scope of practice? Do you know what it means to work within your own scope of practice? Okay, so if you know, you're gonna check that off. So I want you to more use this as a checklist versus really trying to just find material that fits this, because that was already my job. I already did that. I already put everything in the 17 chapters because I thought this is way too overwhelming. How are we supposed to find directions in here? So that's basically what I did. But again, I want you to use this to just double check whether you have studied, if you have the information in your head, if that comes easy to you. All right, so that would be my recommendation. Now let's look at some question structures, okay? Because they are composed, they are designed a certain way, and we better know what they look like. The list, Alicia, is at the NDHCE, NDHCB website. Okay, it is under NDHCE blueprint. That's where you can find it. And I also have it at StudentRDH.ca. That's where you can find it as well. There's a direct link that takes you to the list if you want. Anybody has questions so far about the examination, how they designed it, what the scope of the examination will be? All right, I don't think we have questions right now. So let's continue. So we have questions, and how are they structured? Well, first of all, I want you to know that there are 200 questions, but you might not know that actually 30 are experimental questions. Not every single one of them is graded, okay? Did you know that before? So you have 30 questions, 15% of your examination that is going to be some experimental questions that don't count towards any of your score, okay? So this might be new to you, but anyhow, we just don't know whether it's an experimental question or not. The only thing we know is that it's just a question. So it can be a question that is graded. It cannot be graded. We don't know. So just do your best in order to just make sure that you have the correct answer, regardless of what this guideline is telling you. Okay. All right. So let's continue. It's multiple choice, right? Good news. We don't have any fill in the blanks, matching, or any of those. Is multiple choice. Now, there are two question types. That's one is called independent. The other called is case scenario. As you can see here on the green, inside the green area, I said independent 119 question versus case scenario 51 question. The reason independent question, the green box is larger, longer, is because there are more questions. There are 119 questions that are called independent question, and there are 51 questions that are called case scenarios. Everybody follow me so far? You can answer me via the chat. Thank you very much. So now you know there are independent question and case scenarios, which are case studies. Let's see what they look like. Well, this is like an independent question. Very simple, right? Let's do it together. Cluster of sebaceous glands observed on the buccal mucosa is, and what do you think the answer is? Perfect. So you're all doing amazing. It is called the Fordyce granule. Perfect. It's going to be kind of yellowish, and then you'll be able to just see that if you look inside the buccal mucosa. All right, now we have seen the independent question. What about case? So this is what case look like. So you have a scenario, patient profile, what their concern is, history, intro or assessment. Sometimes they even have radiograph and photograph, so that can happen as well. But here, I didn't put it. This is literally a screenshot of what they tell you it is going to be. So here, so we have all this scenario, and I think you can read it to a certain degree. So let's try to answer number 36 together. So number 36, what do you think the answer is? What do you think the answer is over here? So the answer over here is, well, let's see, chronic periodontitis, because there is gingival redness. Thank you, Sarah, for answering. There's the blunted area, rolled area. There's bleeding 5 to 7 interproximal. So that leads us to chronic periodontitis. Thank you. So, you know, you can understand that there's a scenario and you'll just have to answer those. And Alexis, you're saying 5 to 7, so there is bone loss. Perfect. You know, that the 7 millimeters is a lot just to have inflammation. There's probably bone loss, which leads us to periodontitis. Perfect. So, you know, it's not too complicated, right? However, sometimes there are drugs involved. Who is scared of pharmacology? If you say the patient is taking A, B, C, D, and E, you're like, okay, what do we do next as a question? It's very difficult to answer. So this was one of the easier ones that I picked for us today, but know that this can get a lot more complicated, and they can throw you some radiograph as well, photographs, so you have to be able to identify oral lesions as well. All right, so you have seen independent and case. Now you understand this concept, right? 119 question independent, 51 question is case scenario. You'll have a lot more of those type of questions versus case scenarios. Now, when we look at questions, we looked at what they look like, you know, but we have to kind of understand also what's inside the question, like how are they made? What kind of difficulties will you have? So those are called cognitive domains. So let's look at this first slide that has the 3 types of domain you have. So one is knowledge, one is application, and one is critical thinking. As you can see, application has the most question. Can you think about a scenario where you had to apply your knowledge? For example, you know, it's not in this slide, but let's talk about it. If the patient comes with an ulcer, ulcer looks like yellow inside and with red borders. And they usually are present in movable mucosa, meaning maybe your labial mucosa, meaning the soft tissues. So when you have a patient that comes with ulcer, what do? That's an application, right? You're trying to understand what you can provide to the patient, and it's a little bit more than just knowledge, because if it was just knowledge, it would be, okay, identify this. That's more like knowledge and comprehension. Application is when you do that, when you have this ulcer, what do? Do you provide some sort of drug? Do you let the patient go? Do you treat the patient? And all of that. Critical thinking is one step further. So you'll have many components and you'll have to blend it together. It's like baking or cooking. You have different things to make something different out of it. And the example that they give you here is identify priorities of care, evaluating the effectiveness of interventions provided. And then you need to understand the cause and effect. So if we continue with the scenario of someone having an ulcer, yes, what can you do for the patient? But let's say you treated the patient and then you are trying to assess and evaluate and understand what you're going to do next again and trying to help the patient prevent those ulcers to happen. Well, that's critical thinking, because there's a lot in the mix. Do you understand all of those levels so far? So I would label them, you know, level 1, 2, and 3, because knowledge is the easiest, application is harder, and critical thinking is the hardest, okay? So we have the basic questions that we saw, so the case studies, now we have level 1, 2, and 3, and a lot of questions are at level 2. Now, knowledge, this is, you know, an example that I brought. It says what type of hypersensitivity has the most delayed response, and that would be, if you can shout your answer inside the chat, that is perfect, guys. Layla, Kim, NK, Rita, perfect. We have D, which is type 4. How do I know this? This is how I memorize using wake up memory. And by the way, guys, did you know that so I am the Ontario memory champion? That happened this year. I've been teaching wake up memory for a long time, and finally thought, well, I'm gonna just compete in a memory championship, and actually did win this year in Ontario. So this year I'm going to the Canadian National Memory Championships. So everything that I do to become the memory champion, I try to roll it back into StudentRDH and help you being able to apply that in your studies, okay? Thank you, Saheta, for saying congratulations. You know, it was just a, you know, something that I wanted to try. I pushed myself as well. I want you to push yourself, but I pushed myself and I wanted to validate it as well. So anyhow, this is how I remember it. I say 1 second, 2 minutes, 3 hours, and 4 days. In this case, which one is the most delayed? Is it 1 second, 2 minutes, 3 hours, or 4 days? So in this case, it is 4 days. correct? So when you have 4 days, that is a delayed response, such as contact dermatitis, you might wear jewelry. And if you are like me, who are slightly allergic to metal, sometimes I get some rash, but days later. 1 second is when you have an anaphylactic shock, the patient might actually die. Okay, so that is type 1. Okay, so we now understand what knowledge means. Well, let's talk about application. Let's just look at this scenario. It says, which of the following instruments would be the best choice for removing calculus on the mandibular molar? What do you see on the mandibular molar? Right, we see some calculus, and sorry guys, I apologize. Now I look at the question, I'm like, I missed something. I was gonna say distal of the mandibular molar, okay? So we're gonna say distal, all right? So please put that distal in your head when you read this question. Now you have a few options, right? The straight Gracie, the rigid, the mini, standard, extended, and you have all those different numbers. Can you tell me which ones are for posterior teeth? Do you know which ones are for posterior teeth? Right, we have E, 17, 18 is for posterior, D, 15, 16 is also for posterior, C, 11, 12 is also great for posterior teeth. So all of those, right, the rest are for anterior teeth or premolar, or you can also do it on the, you know, the lingual or the buccal surfaces. What if we use a different set of instruments? So Carrie's asking, what if we use a different instrument? So you have the 13, 14, right? So that is also an instrument for the posterior teeth. It's just not in our answer choice. So 11, 12 is paired with the 13, 14 to do the mesial and distal. And 15, 16 is paired with the 17, 18 to do again the mesial and the distal surfaces. So now we have all this information. We need to understand what is best in order to remove calculus on the distal side of the mandibular molar. What do you think the answer is? We have E, that is very, very perfect. Okay, so E is the answer over here. So Gracie 17, 18 is a little larger, more rigid, have an extended shank, as you can see in the answer choice, and you will have this extended shank that helps you get in those difficult to reach area, which are the posterior areas. Perfect. So that's a little bit of application, right? You have to twist your head a little bit to understand what is going on. Now let's jump to what is called the another application question, okay? Because as we can see over here, application is the one that has the most questions. So another one over here, I'm gonna actually let you read it and then we'll be able to answer it together. All right, so the patient has not been a dentist, he's 38 years old, no real medical condition, but he tested positive for TB years ago. But he says he's okay, he needed a full mouth, and this is what you find. Because he has pain, what do you think the answer is here? All right, we have D, 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 D. Everybody is shouting the correct answer. All right, guys, perfect. So D, peribuccal abscess, I mean, it's very obvious, right? So you look at the radiograph, you put it together with the information you have, such as pain, and then you go to the conclusion, D. That is application, perfect. Now you know this is level 2. Let's go to level 3. Level 3 is critical thinking. Now you just have to twist your head a little bit more to understand the information. Can you read it? And then we'll try to do it together again. So it says here, the patient is taking multiple drugs for his medical condition. That includes metformin, rosiglitazone, anti-diabetic combination, irbesartan, metolazone, and simvastatin. Okay, great. And he came to the dentist because his physician said so. So the question is, which of the following is most likely the reason this patient's physician has recommended him to visit the dental office? What do you think the answer is over here, guys? What do you think the answer is? Okay. B, wow, you guys are great. This is not an easy question because you have to look at the drugs. What conditions do you think the patient has? What do you think the conditions, because they are multiple, the patient have multiple drugs and those are treating different type of conditions. So the patient has hypertension because you see drugs such as irbesartan, which is lows like a 10, so which is an ARB. And then you have metformin, which is used for diabetes. And then he has simvastatin, which is used for, what is statin used for? Hyperglycemia. So he has multiple things going on at the same time. So, sorry, I keep going to the other ones. Diabetes is awesome, guys, as an answer in K. So diabetes is what the patient has. I mean, he has other things too, but he's trying to reduce inflammation because diabetes can cause many different things such as dry mouth, infection, okay, periodontal conditions. You know, the patient can also have weird numbness, pain, tingling, things like that in the body and the mouth as well. And then can also have poor healing, like delayed wound healing. So all of that are related to diabetes. Now, as patient with diabetes, if they can control their inflammation because the whole body is connected, it also helps with their periodontal condition. But on the reverse, if they kind of treat their periodontal condition and reduce inflammation here, the amount of bacteria that helps the body as well. So that's the reason why the patient came to the office. The physician wanted him to come to the office. If the patient came for, the answer is not related to hypertension here because, you know, although there are a lot of relationship with the heart conditions and periodontal condition here, the best answer here would be inflammation. So that would be an idea of critical thinking. Does everybody get it right now? Okay, great. I think everybody is understanding. Yes, yes, yes. Mina, thank you very much. Okay, so now you have understood the three types of levels. Let's continue. The passing grade is 75. However, they just give you fail or pass, okay? And then, you know, you fail, you will get those results as well. And there are some dummy questions, 30 of them as we talked about. Now, in the examination room, there's something that you can bring and some things you cannot bring. And you are not allowed food, water, jewelry, or religious items, okay? Let's say you have a special stone, well, you cannot bring that. You can have a religious attire, that is great. But also watch, and this depends a little bit on the test center, okay, guys? They might not allow your watch, okay? So if you are trying to just have a watch, don't worry, because there's a countdown timer on the computer for the examination. And also at StudentRDH will help you prepare for your board examination with a timer in the mock exam. So you're gonna see the countdown timer, so you actually have the real experience. You can't bring your phone, obviously, so they're gonna give you some sort of cubby. Every place is a little different. Sometimes they pile everybody's belongings together. Sometimes they give you individual cubbies. That is hard for me to tell you which scenario it will be for you. Does anybody have any information on that depending on where your seniors took the examination? I just am curious because, you know, again, I heard many different things. I have my own experience as well. And, you know, in my case, they piled everybody's belongings together, put them in bags, but also some test centers are equipped with cubbies. All right, so medical items, so if you have, for example, some real headache. You have to kind of get permission to bring it in the examination room with you. If you have asthma, you really need this, you need to get clearance first. Understood? Then, provided by the test center. Actually, sorry, you will not be provided boards. There's just a notepad function actually inside your computer. Okay, so you can make notes inside your computer just like your computer notes. However, you cannot use your pen and paper. Now, how are you going to prepare for the examination, right? That's the next question. Now we know the 3 levels of questions you're gonna have. You're gonna have, case studies. Now you know that, and there are different 8 type of domains. However, all of those include, let's say, application to basic knowledge to everything. And that was a long list. You're like, Claire, help me still. How am I going to prepare for this? And that would be how I would like to end this webinar. So how we're going to prepare for this. So first of all, I want you to get a computer format. So it's okay if you have Mosby, Darby, that's great. However, I want you to find a computer because study shows that when you are using a pen and paper and a book, you study better. Meaning when you go to a computer, you're going to score lower. So if you prepare with a computer in the beginning, you're going to be prepared for that specific format. I have seen so many students failing because they were anxious, and that includes because they didn't really know the format or they were not prepared for that. Would you run a marathon after running a 5K, sign up for a full marathon because you felt confident? Well, it's a little different, right? So we want to just practice with the right tools. And then I am trying to transition into this that is about find a complete mock exam. So try to sit on your computer, and as StudentRDH we have it, but if you don't have StudentRDH, try to sit on the computer, find 200 questions, 4 hours. You can take a break right in the middle after 2 hours, but try to go through that without being distracted. Practice again the way you will be tested, because you don't want to go to the examination with just a partial mock exam. The reason I say this is because our body and mind need to be comfortable with a certain format. We are not trained in our lives to perform 4 hours in front of a computer. I mean, we are hunters, we are fishermen, by nature. If you think about our evolution, we were not meant to sit down for 4 hours. Even our sick bones, they say, are too small because we're not supposed to be sitting like that. We're supposed to be walking, running, and hunting. So when you are in front of a computer for 4 hours, what happens is that your body gets really tired, and then you don't have enough oxygen in the brain. Your breathing gets shallower because you're just focusing on the screen, and also you don't have enough blood or oxygen going to your brain. So during your break, I want you to just run, walk, do jumping jacks, whatever you can to bring more oxygen to the brain. But anyhow, the body and mind, if we are not ready for this 4-hour examination, we're going to feel completely exhausted. So I want you to practice with the full mock exam at least once. Now you can tell me in the chat right now, does your school help you? Do they have any sort of mock examination for you, a simulation they run for you at the school? I know, Sharita, you're saying no paper is going to be hard for me, and I totally understand. And I'm too. When I have the opportunity to have pen and paper, I do actually. However, this is just a once a lifetime, I guess, opportunity that you have to just, get used to. You'll just have to be able to use what you have, which is just a computer. So, I just don't want you to make the mistake of just using pen and paper and suddenly you're thrown a completely different format. It's like, do we have any male hygienists over here right now in the chat, in the room? If you are, let me know, because this is what I'm gonna say. It's like you practice with your flats the whole time and all of a sudden they want you to dance on heels. Like that's a completely different thing, right? So this is kind of the analogy that I would like to bring, if you can relate to what I'm saying. Great. So next, tip that I would have for you is plan your study. It's never too early to plan your study. And anybody here is taking the May examination, you can put it on the chat right now. Do you know your exam date, or are you waiting for later? Oh, Kim, you're taking in January. Okay. Anybody else taking it in a different timing? Okay, a lot of you are taking it in January. We have some May as well. Perfect. So we have a mixed group, but anyhow, when you are planning your studying, write down what day what day it is, how many days you have left. Let's say you're taking the May examination, you have like about you have 120 days left. Then you can think, okay, I have 120 days left. How I'm gonna start preparing. What I want you to do is try to just grab this checklist, which is the NDHCE, and I want you to use it as a checklist. And this is again the one that you can find on the NDHCE blueprint. And this gives you another breakdown of the component, 1-A, 1-B, and all of that. And say, okay, I know vital signs. You can check them off to give you confidence, but also to assess, oh, actually, I don't even know what it means to have assessment of epidemiologic data. So then you have to go back to your research or community health chapter you have at StudentRDH. So I want you to use the NDHCE as a checklist to understand what you know and you don't know so you can plan better. And then one last thing over here is that if you have StudentRDH Success Package, which is the new premium package that we have, you will also get a book. And in the book, you have this study planner, but you also can get it free at StudentRDH.ca. So here, I want you to just take quiz 1 if you have, and if you don't have StudentRDH, that's okay. Get another book, get something, get like 20, 30 questions together and do quizzes for all of the chapters. Pharmacology, 30 quiz, head and neck anatomy, 30 quiz, and you're gonna write down your score. And according to that, you're gonna find your priorities. So obviously in this area, I know pharmacology is weak for me. That's why I'm gonna focus more on pharmacology versus pathology, because you wanna tackle your weaknesses first. Those are the big frog. We wanna get it out of the way, because mentally we would like to do things that we like to do. So I want to challenge you to just go with what you don't know first. In this case, it would be pharmacology, and that's what I would like you to do. After that, you say you study pharmacology, head and neck anatomy, or pathology in that order. I want you to take quiz 1 again. After you're done with pharmacology studying, you take quiz 1 again, you say, did my score improve or not? Let's say you got a 60, then you learn from the study guides. You feel good, and you know you're more ready for the examination. And then you take quiz 2, and then you take it again. So you'll be able to understand whether you are progressing or not. And if the score is still below 75, you have to study that chapter again. So I want you to kind of use this. If you don't have it, email me or find it on StudentRDH. You can get it for free. And I want you to just plan it a little bit better. Now, this is the end of our presentation. Just if you wanted the new success package, I have a discount for you. It's Gen 3 webinar that's only valid for 1 week, and it is at $81 discount. However, if you are listening to this later and you really need this discount, just email me and I promise you I'll do something for you. And I just want you to know that, if you email me, I'm always here to answer them. I literally read every single email, and there's no stupid or wrong question. Anything is valid. And I want you to just imagine your success story, because we had over 1,000 Canadian students who passed, over 15,000 in the United States. And you know what that means? You can do it too. You can be one of them who pass the board examination and really start working as an RDH. So this wraps up my presentation today, guys, about the NDHCE. I hope we learned a lot about what it means to have this NDHCE checklist, whether you can bring things in the examination room, or also for me, the most important part was to help you understand the question types, so you understand what kind of question can be asked to you, what kind of levels of question will you see, whether you will see some radiograph with case studies or not. So if you have some last questions, I can take them right now in the chat, please. And thank you everybody for being here and for saying thank you here, Tiana, Saheti, Nazila. I apologize if I haven't shot your name yet. I'm always here again to answer a question. I see some names that came through my email as well, so I know you are using the email function as well. So do you have questions over here? For those of you who are taking the January board examination, I wish you the best. And you know what I want you to do? When you get your results, I want you to come back to me and please share it. Share your success story. I would love to get you on a quick little interview, or you can record yourself for like 2 minutes saying, hey, this is how I felt. This is how I prepared. If I were gonna do it again, I would do this, and that. So, I would love for you to just share your knowledge with other students. All right, Carrie's asking, should I study using flashcards as well? Carrie, do you have your own flashcards, or are you talking about a deck that already exists? And anybody has some comments about Carrie, who's asking whether she should use the flashcards or not? Anybody have some comments over here? Okay, so Carrie, you're saying deck that already exists. Okay, so you probably purchased a deck from someone, or you did it on Amazon. And Alexa's saying, well, I found making note cards waste of my time, even though I love note cards. And you know what, Carrie, I would actually agree with that. Thank you, Alexis, for sharing that. The reason is because when you actually write note cards, what happens is that we write them a lot with the blank mind. I would rather have you being able to try to memorize things as you see them on the computer, or make notes of how you actually memorize it versus rewriting this information. So, I am a memory champion. I teach memory, not just for dental professionals, but for professors, for software engineers. And this continuous repetition is called the rote memory. So you're going to do it again and again. You're seeing it, you're writing it, you're hearing it, you're writing it again. How many of you think you need to write it 5 times in order for you to memorize this information? So that is a rote memory. And that probably is why a lot of students like to do cards, because it helps them memorize it by writing it. It's good, it's an action. However, it takes a lot of time, and we don't have a lot of time here to pass the board examination. So in that same 1 minute, I think if you can focus on how I'm going to memorize this, your time would be much better spent, because after you create the cards, you have to review it again. And you know what? I've seen a lot of students who write them and don't review them as much as they should. They don't really even utilize it. So that would be my advice. Thank you very, very much, Carrie, for sharing that. And it is time consuming, right? And we get tired. So let's just focus on what we are given already and then try to work with that. Alicia is asking, how long before the examination should we really start preparing? That would be, in my mind, so generally, people use around 2 to 3 months in order to prepare for their examination. Okay, that is really a general just idea. Now, it might take you 5 months because your school is really intense and you have a lot of patients to see, and you won't be able to really get any time hard for your board examinations. So that's 5 months. However, if, as they say, the school give you 1 day a week to study, that's 2 months. So, it's hard for me to give you an answer. However, one thing I'm going to just tell you is that if you are prepared, let's say for the May examination or for the fall examination, it doesn't matter, and you got StudentRDH earlier and you just didn't finish on time, and StudentRDH, because it's 5 to 6 months of use, you just email me saying, Claire, I need an extension, and no problem, I will give that to you for free. So I would say the sooner the better though. So you can get yourself acquainted with the formats already, try to do a little bit here and there during lunchtime without exhausting yourself. And Alexis, you're taking it in October, okay. So, again, you can start right now and then you'll be able to pass your October examination. Alexis, may I ask which school you're going to, and is all your classmates going to take the October exam? So Alicia, yes, the program lasted 5 months. Now we're going to extend it to 6 months just to give you everybody more time to prepare. But again, if 6 months is not enough, we have just unlimited extension until you pass it. Okay. Okay. So yes, Alexis, it's better to not stress yourself out. And you are in a false college in midway. Okay. Oh, Alexis, are you in the US? Okay, so if you're in the US, it's StudentRDH.com, not StudentRDH.ca, right? Okay. So I just wanted to clarify that. Perfect. Now, anybody else has a question here? It is almost 1 hour. I thank you so much for being here in January. I mean, the first 3 days already, you are here trying to listen, trying to understand, trying to pass the board examination. That is fantastic, guys. I just wish you the best in everything you do. We might meet somewhere someday. Please say hi. At least we met here over the webinar, over chat. That means a lot. And please share your success stories when you're done, because the goal is to just inspire other students to follow what you have done and to just even do better, okay? All right, so if you need to reach me, my email is clairej, CLAIREJ @studentrdh.com. All right, so if I don't have any more questions, guys, I'm gonna let you go. I just wish you the best. Happy New Year. Make lots of amazing positive visualizations so you can get to the finish line. All right. Bye. And thank you, Carrie, everybody, for saying all the wonderful messages, for participating in the chat.